Part of what I do focuses on breast cancer research, and so I had the opportunity to speak about some of our work on risk prediction for breast cancer. In this study, we looked at estrogen receptor beta, the other estrogen receptor, and we saw that women who had high levels of estrogen receptor beta, who had atypical hyperplasia of the breast, which is associated with a high risk of future breast cancer, these women who had this beta function expressed did very well in terms of future breast cancer and had much lower than expected incidence of breast cancer subsequent to their benign breast biopsy. We're hoping that women who have atypical hyperplasia of the breast have a high risk of future breast cancer, high enough to justify taking medicine like tamoxifen to lower that risk, or to even consider having surgery to remove the breasts to lower risk. But we're finding that within this group, there appears to be some women who have a fairly low 25-year risk of breast cancer, and some who have a much higher risk of being diagnosed with breast cancer at 25 years. So this may help sort that so that they can think a little bit, have better guidance for their choice of risk reduction, whether it's surgery or medication. This is part of the Mayo Clinic Benign Breast Disease Program. It's a unique cohort of patients, more than 13,000 patients, who over time, with follow-up of nearly 20 years, have developed more than 1,200 breast cancers. And this provides us with this really amazing platform to think, to learn about breast cancer risk, and to hopefully now move more toward biomarker discovery for better understanding of risk. Our group is using all the different technologies that you've heard described at this meeting, looking at DNA, RNA, protein expression, multiomics, looking at microbiome, metabolism, inflammation, as well as things such as breast density and tumor histology, things that we've known about for some time. I'd like to see some really getting much closer toward preventing breast cancer, because I think the best way to improve outcomes from breast cancer would be to prevent it from happening in the first place. And as a stepping stone to that, to have much better ways of stratifying risk so we can sort out women who are very unlikely to ever develop breast cancer in their lifetime from those who have a high likelihood of having breast cancer in the next 10 or 20 years. Most of the prevention and early detection efforts are focused on screening women who are at the highest risk, using different technologies to screen women who are at higher risk, and then in terms of prevention, most of it steers around things that block the effect of estrogen on breast tissue. So there are things that are very effective, such as the medicine tamoxifen in lowering breast cancer risk, but many, many women are very reluctant to take this medication because of concern regarding the side effects or potential side effects.